Well, being a Castle Connolly top doctor is a great honor. It's probably one of the highest honors you can get as a clinician because you're selected by your peers, and who knows who's a good doctor other than other doctors. The criteria that I use when I recommend people is would I send somebody from my family, somebody I love, to this person? And so being recognized by Castle Connolly is quite extraordinary. I'm very proud of it. And I use Castle Connolly all the time for referrals to all over the country to make sure that my patients and people who ask me for referrals go to the very best people. Being nominated by a peer is extremely important because who knows who's a good doctor other than other doctors? That's the best way to evaluate it. Some people find doctors by various means. Word of mouth is actually not bad if you have trusted people that you're listening to, but actually finding a doctor because they're recognized by other doctors as being excellent is a very important market distinction and very important to me. Being a physician was it was a hard decision because I was interested in many other things. Actually, I thought growing up I'd be a professional musician, actually. But always the desire to help people and to help society was always there. What happened to me is I was doing laboratory science as a college student at Roswell Park Memorial Institute in Buffalo. And the person running the laboratory was Dr. William Riegelson, a great luminary of oncology in those days. And he brought me to the clinic to see a patient who had a terrible tumor growing in her pelvis, actually causing a lot of pain and bleeding. And he said, we're going to try something experimental. She's not operable. We're going to try to do something experimental. We're going to give her a medicine. It's called chemotherapy. I think in retrospect it was methotrexate because I remember it being a very bright yellow color. And over the next few weeks, I just saw this tumor melt away. I saw the skin heal. I saw the pain go away. I saw her go home to her family. And I said, this is like magic. I'm seeing this monster devouring this person. I'm seeing this magic potion going into this person and actually defeating the monster. And I said right then and there, this was a world I had to be part of. And so that really made me firm in my commitment, not only to be a physician, but to be a cancer doctor. At MSK, we work very hard to make the patient experience as good as possible. For example, I work in the breast center, which was designed very carefully. Evelyn Lauder was a major influence on the design of the building to be warm and nurturing and comforting. For the building to say to the patient, you are the most important person in our life, and to surround that person with people and other services that could help that person. And that's what we really tried to do, to make the patient the center of our attention. And to do everything possible, not only to take care of them medically, but to take care of them psychologically, socially, and even spiritually. We have a chaplain here. That's what's really important about medicine, is taking care of the whole person and not just the disease, and that's what we try to achieve. Of course, we also try to achieve the very highest quality medicine at the very same time, and delivering the highest quality medicine, which sometimes involves clinical trials, new things that are not available anywhere else, and at the same time do it in a fashion that's warm and comforting and nurturing. That's our goal. If you're a patient, the most important thing is for you to enter the medical situation with knowledge. You should read widely. You should use the internet to get questions, not to get answers, so that you're armed with as much information as you possibly can to really get expert opinion from somebody who knows what they're doing. And you should establish a relationship with that person so that you can have an honest communication. And if you don't have an open communication with that person, you should find somebody else. By using the Castle Connolly list is a very good way to do that. And have the conversation so that you get the answers that you need. Not everything is right for every person. And just the highest level of technical medical care is not necessarily what you want. You want that, but you also want to have it in a way that you understand it and you're a participant in the process. Every doctor-patient relationship is a meeting of two experts. The doctor is an expert in biology and medicine. The patient is an expert in their own life. And together they have to come together and come up with the right approach for that individual person. That's extremely important. And you have to be optimistic. You have to look to get better. You have to let the doctor know that you're there to get better and not necessarily avoid toxicity, for example, because sometimes you actually have to have toxicity to get better. You have to make that message very clear. But the important thing is excellence of medicine, but also excellence of communication. I think the doctor-patient relationship has got to be a human relationship, and we have to keep that in mind. It has to be a connection of two humans on a personal level. Having said that, technology is giving us tools to help us establish better medicine in that regard, sources of information both to the patient and to the doctor, for example. More and more medicine is relying on molecular testing, for example, and very specialized imaging. And All those things are extremely important, but they have to be in the context of a human relationship between a doctor and patient, and a doctor and a nurse, and a doctor and a nurse practitioner, and the whole team working together for a common goal, which is the health of the patient. So I see technology helping an enormous amount to get us to the level of actually having better interpersonal relationships and having better medicine as a consequence of that.